Yes. Good afternoon, Mrs. Wimmer.
Good afternoon.
Nice to see you. Please take a seat. So, how are you doing?
Yeah, fine. Thank
Fine?
you. Yeah.
Good. So, we did the examination not so long ago. Last session, you came for an examination.
Right.
And during this session, I would like to speak to you about the treatment plan we've built up from that examination.
All right.
Before the examination, you filled out some forms for me. The COS and the LISON doesn't say anything to you, but I'm gonna give you the scoring of the COS was actually very good. It was an 84, which means you have a fair recovery prognosis for your knee at this moment. So that's good to know.
Right.
Okay, so you mentioned you mainly wanted to regain full motion in your knee, right?
Mm-hmm.
Was there any other case that I'm not allowed to forget about with your knee? How do you want to recover? You said your main request for help was the ensuring that the instability in your knee is gone.
Yes.
And you feel more secure.
Yeah.
Are there any other aspects that I forgot to mention?
I got to no. I can't really think of any right now.
No.
Mm.
Okay. So during the examination, it was very noticeable. You noticed also during the active examination that you had some issues with the extension or putting your knee in a straight position.
Mm-hmm.
As well as rotating your lower leg inwards.
Yeah.
That was the main issues that was noted.
Mm-hmm.
So I decided that the treatment plan we're going to focus on first is trying to stabilize your knee in such a way that your lower leg is aligned again correctly with the tibia and the femur.
Mm-hmm.
I made for the first session, we're going to work on the internal rotation of your lower leg.
Mm-hmm.
We're going to do it by stabilizing it.
Okay.
So stabilization exercise. I'm going to give you a whole form with all the exercise, so you don't have to be afraid. I'm just going to go bit by bit to explain what my plan is exactly. So I first want to ensure the stabilization, that your knee is aligned correctly again, that you don't have that much problems with your bending down and squatting, as you mentioned. Then I would like to go on and strengthening those muscles that help the rotation, so the muscles all on the medial side of your knee.
Mm-hmm.
And after that, I decided I would like to go to another exercise, which is more for the stabilization of the medial knee again. This is also mainly to really strengthen now and stabilize the ligaments and muscles around your knee on the inner side, because you mentioned you have so much pain on the side.
Mm-hmm. Right.
Yeah. So then after that's done, it should be we're going to test again if the stabilization of your knee is correct.
Mm-hmm.
If it's correct, this should be done within 3 weeks. This should be stabilized accurately, hopefully, if everything goes according to plan. Then I would like to go on to getting back to the actual problem you're having, which is the bending down and the squatting. And so I'm going to start off slowly. I would like then you to start off with an exercise to strengthen the flexion in your lower leg, but not having the full weight on there yet. Mm-hmm. So we're going to do this while sitting, with a sitting exercise. Mm-hmm. That your muscles get used to the action again and can strengthen in that position. And then after that, we're going to definitely go to the squat, a very famous exercise. But we're going to take it slowly. We're going to do first a partial one, just literally to have your left knee secure, that you feel comfortable. You can do multiple repetitions, but that you don't make too many mistakes. It's also important that we do it correctly.
Yeah, right.
And then after that, I want to do the standard squat, and then we're going to focus on strengthening all the muscles with the squat, so that in the future you won't have any issues.
Oh, nice. Yeah.
Would you agree with that plan?
Sounds good.
Sounds good?
Yeah.
Do you have the feeling I had enough, I respected enough your wishes in this way?
Yeah.
So, I did before in the examination, I did 2 tests, very important tests. That was the McMurray test and the Drawer test.
Mm-hmm.
It was to assess if you have osteoarthritis, for example, if that is the issue at this moment. The testing was negative, which is good news. Which means we can, the prognosis of recovery is just faster because there's not another pathology or other disease in amidst. As well as I did the drawer sign test, and that was now to assess if there's not a ligament that is torn inside your knee, which is also negative, which is a good sign. That means the recovery will be faster as well. So if everything goes according to plan, we should be finished within 6 weeks, and you should be fully recovered in your knee.
Good. That's nice to hear.
Yeah?
Yeah.
Do you have any questions?
You gonna give me the exercise and I have to do them at home, or do I come regularly here and we do them together? How does
That's
it
a
work?
good question. We're going to meet once a week because every exercise I would like to start off with you to ensure that you're having the correct positioning, you understand the exercise, that is performed correctly, and that you feel secure enough to then take the exercise home and do the exercise for that week at home.
Okay, yeah.
And I'm going to give you a whole sheet with the entire treatment plans, also how long we're going to work on everything and how.
Yeah. Oh, that's great, yeah.
Yeah?
Keeps me on the toes.
And yeah, definitely. Are there any other questions or?
No, I don't think so.
No?
No.
Okay. Then I'll see you next week, and then we're going to start off with the first exercise.
Okay.
Yeah?
Thank you. Thank you.
You're welcome.
Yeah.
Have a nice day.
Yeah. Bye-bye.
Bye.
Thank you.